Hello, we are on your screens once again. This is Health Spa, your number one channel on all health issues you can think of. Today, we are talking about malaria, specifically malaria in pregnancy. By the end of this presentation, we should know the burden of malaria and public health challenges posed by malaria, the transmission of malaria, maternal malaria, symptoms of malaria, diagnosis of malaria, treatment of malaria during pregnancy and postpartum, and lastly, prevention of malaria in the community and during pregnancy. Stay tuned with me. Let's get more into it to learn a lot today. Malaria is a life-threatening disease caused by the protozoan Plasmodium that is transmitted to people through the bites of infected Anopheles mosquitoes called malaria vectors, which bite mainly between dusk and dawn. There are 4 protozoan species that causes malaria in human. 1. Plasmodium ovale, Plasmodium malari, Plasmodium vivax, and Plasmodium falciparum. Plasmodium falciparum and Plasmodium vivax are the most common, but Plasmodium falciparum is the most deadly one. Now, the burden of malaria in pregnancy. Globally, an estimated 2.3 billion people in 97 countries are at the risk of being infected with malaria and developing the diseases, of which 1.2 are at high risk of contracting malaria diseases. That's from WHO 2014. Malaria primarily affects low and lower income countries and within endemic countries, the poorest and most marginalized communities. Most of malaria cases and deaths occur in sub-Saharan Africa, but Asia, Latin America, and to the lesser extent, the Middle East and part of Europe are also affected. Approximately 25 million pregnant women are at risk of infection by the Plasmodium falciparum annually in Africa. That is from WHO 2014. Again, a recent view of studies in East and Southern Africa found the following prevalence of malaria in women attending antenatal clinics. That is 32% of peripheral malaria and 38.2 for placental malaria. In areas of stable transmission in sub-Saharan Africa, 1 in every 4 pregnant women has evidence of peripheral or placental infection with malaria parasites. Now, what are the complications of malaria during pregnancy? Parity and age are important determinants of risk of infections among pregnant women. Younger age maternal, that is the adolescents, have poorer immunity to malaria compared to their older and multiparous members. The risk of infection is also highest during the second trimester. Let's check these statistics. In Africa, a quarter of cases of severe anemia in pregnancy are attributed to malaria. The percentage of maternal deaths attributed directly or indirectly to malaria is approximately 10% in both hospital studies, 0.5% to 23%, and community-based studies, 29% to 17.6%. This does not differ much from estimates in low transmission regions outside Africa, that is 0.6 to 12.5%. Placenta malaria doubles the risk of low birth weight compared to multiparous women. Low birth weight in itself is a major risk factor for neonatal mortality, but malaria-induced low birth weight is estimated to be responsible for 3 to 17 deaths per 1,000 live births. It is also estimated that 11.4% of neonatal deaths and 5.7% of all infant deaths in malaria endemic areas of Africa may be caused by malaria in pregnancy associated with low birth weight. This means malaria in pregnancy is a very dangerous disease and needs to be tackled and learned a lot about. So the consequences of malaria in pregnancy: stillbirth, spontaneous abortions, fetal anemia. May also be consequences of maternal parasitemia. Placental malaria diminishes fetal cellular and antibodies response, making the infant susceptible to malaria. HIV increases the risk of placental malaria infections. High density, febrile illness, and worseness, severe anemia, and low birth weight. The transmission of malaria. Malaria is transmitted exclusively through the bite of female Anopheles mosquito. The intensity of the transmission depends on factors related to the parasite, the vector, the human host, and the environment. Now, symptoms of malaria: headache, fever, weakness, vomiting. All these are the signs and symptoms of malaria. To prevent malaria in pregnancy, pregnant women attending antenatal clinics have to be taking the IPT to help them protect themselves from malaria parasite. Again, they need to be sleeping under treated mosquito nets to protect themselves from malaria. To protect them and the child from getting infected by malaria, they need to make sure they have clean environment and also continuously attend antenatal care and have subsequent lab search to help save the child. Malaria in pregnancy can kill both the mother and the child. Save a child today, save a mother today. This is Health Spa, your #1 health channel. Stay tuned for more. Thank you.